Hey guys, what's up? I'm Lala and welcome to FearlessRN. If you're new, welcome. I hope that you'll join the FearlessRN family, and if you're returning, hey! And thank you for returning and supporting as well. For today I will be sharing with you some strategies on how you can answer your NCLEX questions to determine the correct answers. If you're interested, keep on watching. The nursing process helps us to analyze a question. It includes ADPI, assessment, diagnosis, planning, implementation, and evaluation. When answering NCLEX questions, you want to make sure that you're reading them carefully. So take your time when reading the question. Then read the answer choices. Based on the nursing process, the first thing you want to do is assess, then plan, and then etc. Right? So you always want to keep that in mind as you're reading the question and reading the answer choices. Read the answer choices again. Determine which step in the nursing process is needed and will be implemented as shown in the answer choices. Remember, you always want to assess before implementing any intervention. If a patient has come back from surgery, what would be the first thing you do to this patient? Would you raise the patient's head of bed? Would you check respirations? What would you do out of those two things? Is the Maslow hierarchy. And this is just a little chart of it right here. Maslow hierarchy helps you to establish prioritization. Physiological needs comes first. Because it consists of the most basic human needs, it comes first. Is think about patient or client safety. On NCLEX, patient-client safety is number one. You want to think in terms of what can I do to prevent this? What can I do to maintain optimal health? You always want to look at the criteria which pertain to safety, like the lab values. Are they within normal limits? Drug administration, ADLs, and maybe even nursing care procedures. You always want to think about safety, 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 safety. And a tip for you is to always address the patient before an equipment. If you come into a patient's room and the patient is hooked into a mechanical ventilation machine and it's beeping, what are you going to check first? The patient or the machine? Comment below. Is using therapeutic communication. You know that communication, nonverbal and verbal, are very important. So therapeutic communication on NCLEX will be important too. It's important to communicate effectively, verbally and non-verbally. You want to listen to your patient. You want to paraphrase, which means that the nurse has listened to what the patient said and can verbalize it back to the patient. You also want to clarify, make sure that you understood everything, and you also want to encourage the patient to talk. Make it a calm and safe environment for the patient to want to speak. A lot of information can be given just by communication, verbally and non-verbally. Alright, so those were some strategies that I thought would be helpful for you when answering NCLEX style questions. So I hope that it was helpful for you today, and if it was, please give it a thumbs up and comment down below any topic that you want me to discuss. Invite some friends to join in on the FearlessRN family. I've also opened up a Facebook group called Fearlessly Becoming RN, and it's brand new and I am kind of a little bit lost in it. So if you would like to join me there, I'll leave the link down below in the description box. You can share any questions that you have found, questions that you may have trouble with, any mnemonics, any pictures that can be helpful for anyone who's in nursing school or taking the NCLEX. If you're interested, then join me over there, as well as my Facebook page too. So with that being said, I'll see you guys later. Hit the subscribe button on your way out, and I'll see you guys in the next video. And good luck. Bye.